This is the third video in a series of 4 videos on Helicobacter pylori and will discuss diagnosis. There are 4 investigations that the doctor can do to diagnose Helicobacter pylori. The first is a blood test. The simplest and least expensive way to test for Helicobacter pylori is a blood test to look for antibodies to Helicobacter pylori. Antibodies are proteins that are produced by the immune system as a response to bacterial infections. The test is not very accurate and does not tell us whether the Helicobacter pylori infection is still present, that is active, or existed in the past, means that it is a past infection and has since cleared. This is because the antibody persists for years even after the Helicobacter has been cleared from the stomach by antibiotics. Generally, if the test is positive, the doctor might order further tests to confirm whether the Helicobacter is still present in the stomach lining. These other confirmatory tests will be discussed shortly. The second examination is a stools examination. This test looks for antigens to Helicobacter pylori in the stools. These proteins are called antigens and are associated with the bacteria. The stools test is more accurate than the blood test but is also more expensive. The third test is called the Urea breath test. The test is called the Urea breath test, or UBT in short form. The test involves swallowing a tablet or powder containing a chemical called urea, which is attached to radioactive carbon-14. This radioactive carbon-14 has a tiny amount of radioactivity. In fact, the amount of radiation you take for the test is less than the amount of radiation you receive outdoors in a day, or about a quarter of what you would receive with a chest X-ray. However, this test is not recommended if you are pregnant or breastfeeding or for children. The first step in this test is to take a sample of your breath by blowing into a balloon or a container. Next, you swallow the capsule containing urea with the radioactive carbon. When the capsule is in the stomach, the Helicobacter pylori produces an enzyme that breaks down the urea in the capsule to ammonia and carbon dioxide. The carbon dioxide is eventually exhaled in the breath. The exhaled breath is captured within a plastic bag and sent to the laboratory for analysis. In the laboratory, the radioactive carbon-14 in the carbon dioxide is measured by an instrument. Helicobacter pylori is present in the stomach and the exhaled breath will contain the radioactive carbon. If Helicobacter was absent in the stomach, no radioactive carbon would be detected in the exhaled breath. The patient is advised to avoid eating or drinking for at least 6 hours before the urea breath test and should stop taking certain medications as these would make the test inaccurate. These include medication which reduce stomach acidity. These medicines are called proton pump inhibitors or PPIs and should be stopped for at least 2 weeks before the test. PPIs include omeprazole and drugs similar to this. All antibiotics should be stopped for at least 4 weeks before the test. This test is accurate and, if positive, it confirms that the Helicobacter pylori is present in the stomach. The fourth method of detecting Helicobacter pylori is upper gastrointestinal endoscopy or gastroscopy. During endoscopy, the doctor will take a few pieces of stomach tissue using a biopsy forceps. The patient will not feel any pain when the tiny piece of stomach lining, called a tissue, is pinched from the stomach lining. The tiny break in the lining will heal by itself within a few days. The tissue that is removed is then placed in a plastic slide containing a gel, and this test is called the rapid Urease test. If Helicobacter pylori is present, the color of the gel will change within an hour. The principle behind this test is that if Helicobacter pylori is present, it will break down urea to carbon dioxide and ammonia. The ammonia increases the pH in the gel, and this results in the yellow color of the gel before the tissue was placed in to change to red. This slide shows the pronto dry test, which is a type of rapid Urease test. The gel is yellow in color before the tissue is placed in. If Helicobacter is present, the color of the gel will turn from yellow to red. This means that the test is positive. The test is called a rapid test because it takes about an hour or so for the gel to turn from yellow to red if the Helicobacter pylori is present. The tissue that is taken can also be sent to a laboratory for culture of the bacteria in a media and also to check for sensitivity to antibiotics. An antibiotic can be used to treat patients with Helicobacter if the culture and sensitivity shows that the Helicobacter in the patient is sensitive to the antibiotic. Normally, the results of the culture and sensitivity will take about 2 to 3 days to be ready. This slide shows what happens in the test for culture and sensitivity. The tissue from the stomach that is taken during gastroscopy is sent to the laboratory where it is cultured in a media. This picture shows white dots on a red media. These are colonies of Helicobacter pylori that has grown in the media over a period of 2 to 3 days. This test is very accurate to diagnose Helicobacter pylori. However, it is not routinely done and usually done in a select group of patients, particularly in those patients who do not respond to the usual course of antibiotics, as this test will tell the doctor which of the antibiotics the Helicobacter is sensitive to. Another test that can be done is called the histopathology examination or the HPE. In this test, the stomach tissue is placed under a microscope in the lab to see whether the Helicobacter is present. Among the 3 tests that I mentioned here, the one that is usually done by the doctor is the rapid Urease test, and this test is fairly accurate in confirming the presence of Helicobacter pylori in the stomach lining.